Good afternoon. Welcome to this new webinar of TransplantChild. My name is José Ojeda. I am the coordinator of the working group of quality and safety. I work in the coordinating center at the Hospital La Paz in Madrid. And this afternoon, we will talk about the analysis of the stakeholders' needs and expectations. As I mentioned earlier, we have a background in our working group. As I mentioned, I work in La Paz Hospital in Madrid as the coordinator of the working group. We have a technical director, Dr. Wember, from the Karolinska Hospital in Stockholm, Sweden. And we also have a patient subcommittee representative, who currently is Stefano Pavanello, from the Association for Lung Transplant of Padua. You may already know, and if you don't, because you don't know the work of our working group previously, well, we have been developing through these years of the network some quality standards, mainly at the beginning taken from professional expertise, and also because we have been gathering activity data from the transplantation programs of the healthcare providers belonging to the network these last years. We have in our plan of the 5 years of the network a step to take on, that is that we have to focus on identifying other quality standards, mainly from other points of view. We already have talked about patients and families' point of view, but today we want to broaden that point of view. No? We want to, in general, propose to the network, to all our stakeholders, not only our healthcare providers, to explore their point of view, no? Because as you already know, European reference networks have been developed as virtual networks, and there is no direct relation with the patient, but as we have a structure that is common to all the European reference networks, we have some stakeholders there, but also in relation to the transplantation process, we have also identified other stakeholders. Another important point is that, as you may probably know, last January the 1st, new members officially joined the different European reference networks, also in our TransplantChild. And with these new members, our network has grown into 40 healthcare providers from 21 different countries all along Europe. In fact, some of the new members, a few of them were already working with us for the last 1 or 2 years because they were already affiliated partners, but a big group of them are new full members. And as we will discuss during this presentation, it's a good opportunity in order to explore the needed expectations of those new members, because probably they will have different point of views to the already old full members. So we will discuss also about that in the following slides. And it's also important to say that in a couple of weeks, in some weeks, we will celebrate our 5th birthday. And this is an important step, no, in order to, in this 2022, identify what will be our next steps, so we can keep growing and developing all around our issues and help and taking into account the opinion of our stakeholders. In this process map, we can see what are the main processes of our network. European reference networks in general are focused to the healthcare professionals of all the centers participating. And what we try to do is to promote the exchange of knowledge, expertise, and resources all around our healthcare providers, full members and affiliate partners. And we also have been developing now through these last years the virtual consultation. It's through a CPMS, a tool that allows professionals from different centers to put up clinical questions around the topic of every network, in our case, transplantation. And well, it can be, for example, advice around pre-transplant issues. It can be about the transplantation process itself, or it also can be about all this period that we follow up the patients that have been transplanted and that stayed with us until they reach of age and they are being transferred to the adult setting. As you can see also in the slide, this virtual consultation is not in direct relation with the patients, but our clinicians are responsible to be in contact with the patients and their family and relatives in order to get the needed information to put this virtual consultation and get them the feedback that they have obtained through this panel discussion. You can also see in the slide that we also are in contact with patient associations. In fact, is one of the key elements of all the networks. And in our case, we also have some specific support processes. For example, one of them is the donors organ allocation authorities that, although it's not inside the scope of our network, has very strong connections to what we do. In fact, some of the data that we have gathered during this last years have been obtained through them. Of course, as in other clinical processes, we also have relations with the industry. For example, in those that are related to the diagnostic and treatment facilities that we use in the different hospitals, those who can facilitate the training and decision support that the professional have to take in order to provide the care, the drug and medical devices, or even STEM agencies not related to DG that provide that will provide research and funding opportunities, and also other stakeholders that we have been working through these years that we have been working with them in order to improve our information systems and registries. So if we want to summarize what can be our stakeholders and interested parties, well, as I mentioned before, patients, families, and relatives, they participate, although not directly, with the processes of our network. But as I already mentioned, the patient organization representatives have an important role in all the networks, and this will be increasing in the future. As I mentioned, healthcare providers are the main reason of our existence. They can be full members or affiliated members according to the different calls that have been provided by the European Commission and the member states. And well, we try to focus to the healthcare providers, not only including medical specialists, but all healthcare professionals that are involved in our case in pediatric transplantation. As I mentioned before, as we are a network, a European reference network, we also have stakeholders like the European Commission, the member states, the ERN coordinators and hospital managers that are mainly involved with our process in the strategic and management level. And as I mentioned also, well, we work with the industry, the manufacturers, suppliers of clinical devices, pharmaceutical and clinical trial promoters, and as I mentioned, donor and organ allocation authorities, and also living donors. As I mentioned, we are trying to focus on needs and expectations, and well, perhaps we have to spend some time, this slide, to explain what can we obtain if we focus on that. As I mentioned, we can use as an example these new full members that have joined all the networks. The difference between needs and expectations and satisfaction is that you usually ask for satisfaction when satisfaction results in your stakeholders when they have already been provided a service. So they have an opinion, they have a value, no? They can evaluate the level of satisfaction that they have gathered in order when you have provided them that service. No, so for example, no, satisfaction in our case will be we can obtain them with, for example, the full members that have been in the network from the beginning, or the patient organization that have been already in contact with the network, etc. But needs and expectations are a step further. We try to work on needs and expectations when we try to obtain information from those stakeholders that haven't had or necessarily have an experience with us. So, for example, these new full members that are joining the networks now, what they will probably have is, if we ask them about them, it's needs and expectations, and that's the idea. We want to have all the feedback, not only the satisfaction measures, but also we want to collect needs and expectations, because in both cases they will help us to improve in the PDCA improvement cycle that you can also see on the slide. Satisfaction measures and needs, especially needs, can be considered as requisites, as something that we have to achieve as a network. And so we can define actions that we will have to follow up and evaluate in order to improve the services that we provide to all of our stakeholders. Expectations is in some way an issue that we can decide whether to take them into our improvement cycle or not. The difference between needs and expectation is that the needs are something that you believe that you have to put into place, and expectations are something that your stakeholders desire, but you are not. It's not compulsory for you to put them into place. Of course, we have also to talk about the methods of collection. We have some of them. You already might imagine that we can undertake targeted surveys and polls. We have also tried to put into place in our network a place where we can receive complaints and suggestions of our stakeholders that need to be managed, and to be answered in the specific times. And we can also undertake proactive actions like focus groups or targeted interviews, so where we appoint those stakeholders we want to get the information from. No, we make semi-structured interviews in order to get those data, and we can analyze them in a qualitative way. And of course, we have to remember about the formal participation that all our members, that all of our stakeholders have in the network governing structures. For example, last December, we had our board of the network. It took place in Seville. And well, those meetings are good places where we can gather that information. And well, we have probably to establish that this can be one of the methods of collecting this data, this output. If we want to see an overall view, for example, we can structure 4 main groups of stakeholders. The first one would be the full members and affiliated partners. As I mentioned before, when the launchment has been taking place, probably we will have to ask them for different needs and expectations and satisfactory measures, because some of them have been already working inside the network for some time, and they can give us more information about the service that we have provide them, but probably others, like the new full members, will tell us what do they expect from us, but they would not have now a specific satisfaction level. The patient's representative is another of the stakeholders involved. European Commission and member states. In the near future, in our monitoring system, both stakeholders will also give feedback of the evolution of the activities of the networks. And as I mentioned before, other stakeholders that in the case of pediatric transplantation can be summarized as the industry and the donors and allocation authorities, national authorities. We can have a proactive methodology in order to gather that information. As I mentioned before, questionnaires, surveys, focus groups, or interviews is one of the ways. And we can have reactive methodology that we probably, through the management of complaints or other incidents that we could be able to gather, that we will gather from the meetings, the different information that we collect in the coordination center. Most of these outputs will be gathered in the Quality and Safety Working Group, but we also have a specific structure in our network, the Ethics and Transparency Committee, that it has been proposed that it will focus on the complaints and their management in order to support the network and give an appropriate answer to our stakeholders. And well, as I mentioned, these next years of the networks is also a chance in order to get new tools in order to analyze and identify these outputs. No? So I wanted now to talk about the Net Promoter Score. As you can see in the slide, is something that you have probably seen in other places where they ask you about the willingness not to recommend somebody's product or service that you have received. This index has the characteristic that can provide you can provide you a better view of the overall satisfaction and the loyalty. That the possibility that somebody that you have provided a service will repeat, that will recommend others to get that service. And as I mentioned, well, it has been used now. It's being used also in our healthcare centers because it is it gives you like a better view. It's not as, I mean, it makes you more clear now that you have to focus on those stakeholders, those customers, those patients that will actively promote what you are doing. Those are our focus. That will be, if you see in the slide, those that point you in 9, 10, or give you a green face. Those that don't recommend you as high with a 7 or 8 or a yellow face, well, those are passives. They will not say something positive or negative about you, so we don't take them when we calculate the Net Promoter Score. And especially, we focus, or we give the detractors a range from 0 to 6. So as you can see, it's more exigent. It gives you, it's more difficult. It gives you more opportunity to improve what you are doing. No? And well, probably what we can do with this analysis that we want to launch is to use some of these new tools in order to get not only this index, but also the possibility that those who answer these surveys know that can be offered when you provide some service, when we provide some service from the coordinating center, for example, but you will have the chance to point, to evaluate with a number from 0 to 10, but also to give in an open box information about the reasons why you are promoting or not promoting that service, and that can be managed, and we can identify from that also needs and expectations. So what we propose to do in this 2022? Well, as I mentioned before, we have to work the quality standards that we have settled for our network. Not only gathering and analyzing the activity data that we have been collecting all these last years, but also taking into account the point of view of our stakeholders. Although some of them may not have direct relation to the network, we have to provide some simple ways or some easy ways to collect them. We ask you to not only our healthcare providers, but other stakeholders who may have experience about collecting needs and expectation to identify which methodology you are using at your organization. And please share it with us, because as we mentioned before, we have we are proposing to accomplish this in this year. We are proposing to adopt and to elaborate a common procedure for collecting needs and expectations. And one of the possibilities, as I mentioned before, is using online service, including Net Promoter Score methodology. We hope that you help us, as I mentioned before, the view of our stakeholders will help not only our network, but also the way that we try to improve as a European reference network specialized in pediatric transplantation, the care that we provide to children with this specific need all over Europe. Thank you very much.